Good afternoon, everyone. How are you? Thanks for joining us. Today we're going to be talking about, is it time for a facelift? It's going to be rather informal. We're going to go over different types of facelifts, where I perform them, how I perform them. There's going to be some graphic images, so it says graphic on there, so if you don't want to look, turn away. We'll go over some of the most asked questions, and then at the conclusion, this will probably be about 20 to 30 minutes or so. Feel free to ask me any questions. We're going to go over a lot of things that you might be wondering about, but still there's always questions. All right, so this is somebody 52 in like 1988, this is somebody 52 in 2022, and obviously these types of celebrities have access to trainers and nutritionists and dietitians and all the best and latest and greatest in surgery and in non-surgical treatments as well. But this is sort of the changing landscape of how people view themselves, and whether that's healthy or not, I'm not sure, but these are the ideals that people see and that maybe I should be doing something as well. Obviously, it's not just Hollywood. This is Martha Stewart, she's 82. Obviously, this is not red light therapy, collagen powder, or a good night's sleep, all right? It's much, much more than that. So you don't get your eyes looking like that without a brow lift. There's lots of neuromodulators going on, and 100% she had a deep clean facelift. So, these are the things that are going on. Some people are a little bit more transparent with them, and other people want to hide things. I think that the norms are switching in terms of what people talk about. Then we'll get into that a little bit. So what causes facial aging? A lot of it is genetics. So when I do a lot of consults, people say, I see my mom, and I don't want to see this, I don't want to see this. Ethnicity and gender, usually the people who are a little bit darker complected usually have thicker skin. That thicker skin doesn't have many wrinkles, but it can still become droopy. And then environmental factors like sun exposure and smoking obviously degrade collagen, and then you can see the effects of aging much quicker than you would in somebody who doesn't. There's actually a good study that was shown that showed twins, and one person kept up with sunblock and another did not, and she was a smoker, and the twin who did not use the sunblock and was a smoker looked at least 15 to 20 years older than the twin. All right, so this is sort of the egg and the raisin and the grape of facial aging. So we want everybody to look like an upside down egg, width going to narrowness. However, as we age, everything droops. All right, so everything comes down, and so you start to square off at the bottom of the jaw will start to form, and then all these folds in here become deeper because the ligaments, which are holding under the face, tend to be a little bit weak, and you get fat deflation in certain areas around the face, and then laxity of the skin, laxity of the muscles. So, we come into the world looking like a grape, and we leave looking like a raisin, so we want to keep the juice. And what the juice is usually a combination of filling, whether that's with fillers or fat, and repositioning. Okay, so repositioning is surgery, meaning we take the tissues that have fallen and we resuspend them. Which brings us to the 4 R's of facial rejuvenation, basically redraping, those are facelifts and brow lifts, relaxation. Dynamic movement isn't changed by surgery. So when people say, I don't like when my nose lines when I smile, I don't like these crow's feet, surgery really doesn't take care of those things. We rely on neuromodulators, Botox, Dysport, or the like, to take care of these things. On top of that, we have resurfacing lasers, whether it's an erbium laser or a CO2 laser. They can be tailored for your different skin type, and they can help sort of dial back that aging, that sun aging. So we want to refresh the skin, help take care of the fine lines in and around the mouth. So a lot of people complain about the lines. It's due to a loss of fat. It's also due to sun damage, continued muscular action. There's lots of things we can do about that. And we talked about filler and fat. So what exactly the facelift? Everybody has a different perception of what one is. And there's a lot of people out on Instagram or TikTok saying there are different types of facelift. It's restore or prevent or this or that. But basically, they're all somewhat the same. Every one of us has different tricks and techniques that we have. But for most people, when you talk about a facelift, it's resuspending the lower 2/3 of the face. Right? So that means addressing the neck, addressing the jawline, and addressing the mid-face. Everything above here is not a facelift. That's considered a brow lift or a blepharoplasty or eyelid surgery. And so a lot of times we'll see patients and they say, oh, do I need a full facelift, thinking that it's involved pulling the brows back as well. But for me, it doesn't. It's from here down. So why is it so popular now? So it's I think it's 33% increase in facelifts over the last year, which is a lot for plastic surgery. That's big time. So why is it so important now? Well, a lot of it is due to Ozempic, right? So it really is. We have a lot of people on this medication. It actually, you lose the weight, but you also lose weight in your face. And when you lose weight in your face, you can look hollow or cadaveric almost, so sort of very too gaunt. When you're too gaunt, you look odd, you look older, right? So it also, with massive weight loss, causes there to be a laxity in the neck. Now, she's had 2 facelifts at least, but that's where you see those platismal bands. You need to resuspend that. When a lot of times a heavier neck, fat will obscure that. You won't be able to see it. So Ozempic is playing a role, definitely. Filler fatigue. There's a lot of people who have had filler and filler and filler, and a lot of misconceptions that filler lifts or filler does this, or filler can affect the facial ligaments. It can. That's not true. All filler does is it can re-establish volume, but there's really no lifting effect to filler. Instagram and TikTok surgeons, everybody has an Instagram, everybody's going out there and telling what their specific sort of techniques are, and then just increased awareness overall. Everybody has access to the entire world's history of knowledge at their fingertip these days, and unfortunately you can find somebody to corroborate your beliefs. Not all of it's true, right? But I tell patients, you can find somebody to say the earth is flat out there, you think you're right. Increased transparency. Anybody know who this is? It's Mark Jacobs. One of my colleagues did his facelift, and he was in his hyperbaric chamber posting it, and he didn't even know the surgeon didn't even know out in New York City. They're like, oh my God, Mark Jacobs is posting. But it's, these people are going through this and not afraid to say that they're doing these things. So what can it treat? So, like I said, the facelift doesn't treat the eyelids or the brows. It doesn't remove the fine lines around the mouth. And it doesn't restore lost volume to the face. Although if you do a deep plane facelift, you can reposition the fat up here. Even with the deep plane facelift, some people still need what's called fat grafting. So when is it time? What's the right age? Well, it sort of depends. It's not specific for everybody. People who have genetically been blessed with a strong jaw or high cheekbones tend not to show signs of facial aging earlier. Like when I show this picture, you'll see it, but Angelina Jolie has a very exceptionally strong jaw and a strong chin. The weaker your chin, the weaker your jawline. All right, so a lot of times they'll say, I think you should have a chin implant. You're like, what? I don't look like Jay Leno. No, it's not that. It's a cantilevered effect. It's sticking the chin out further so this area can be stretched. The ideal age, it's usually around 48 to 55, which is the wheelhouse of when people really do this. Yesterday I did a patient with 74 though, but it was her third facelift. It often coincides with the onset of middle age, kids leaving the house, doing something for yourself rather than others, finally saying, okay, I can invest in me at this time. Having a facelift earlier rather than later is preferable. 48-year-old skin is very different than 72-year-old skin. what happens as you age, your skin elasticity isn't really there anymore. So you can pull it and it just sort of falls. So when we resuspend it, skin has an inherent relaxation time. You will relax a little bit sooner if you're older, just because of the integrity of the skin. So the motivations are to look your best, right? Everybody's doing, veneers, or you're doing, an exercise routine, or varicose veins. You're just trying to get, look your best and keep looking your best for as long as possible. And this goes along with wellness and eating well and everything that comes about with that. A lot of times we see a lot of people who are in the public eye to a certain degree and want to stay working. We have a lot of real estate agents who are out there, and they really want to be looking their best. But there's no real official age in which I say it's too early or too late. It all sort of is independent. Obviously, patients who are unhealthy are real candidates. People who have bleeding disorders, that's a huge issue. People have scarring problems. People who've ever had radiation to the head or neck, they're usually not candidates at all. So how young will I look? I tend to under-promise and try to over-deliver. I'm not going to say you're going to look 30 years younger. Some people do. There's a lot of literature out there that says that you can look, 4 to 8 years younger. Usually I tell people, I have them bring pictures in, and I'll sometimes discuss with them, you'll get close to this, you'll get close to, maybe if you're 55, you'll get close to 40, something like that. What also helps is other procedures, right? It's not just this that's aging, everything else is too. So sometimes things can look out of whack or not right. If everything looks super tight up here, then you have just a heavy brow, right? So you want to, attack everything at once. Can you parse things out? Yes. I'm not a big proponent of that. I think that one downtime is preferable rather than having all separate sorts of downtimes. But everybody's their own judge of how they want to proceed. And I akin this to like going up the escalator of aging, so we don't want to trip and fall. We want to bring it back a couple steps. But the escalator still continues on. Like I said, this is the perfect jawline. It is basically out of a book, which is the criteria for a youthful neck. Basically, you want to see the chin, you want to see the jawline, you want a very crisp angle down here. You want to be able to see this muscle right here, it's called the SEM. You want to see the larynx a little bit, that's the cartilage bulge. And sometimes you can accomplish it with facelift if you have the right bone structure, but if you have the wrong bone structure, I can't change that. I can just do as best as I can with what your bone structure is. All right, so how is it done? There's a wide variety. Sometimes I can do these awake, and I'm doing this, and it's got to be the right person. You have to be able to sit still. You can't have super amounts of anxiety, because it'll be torture for both of us. But a lot of times we go to the hospital and do it, and if I'm doing a more in-depth thing, or I'm doing lots of different procedures, some things you can't tolerate in the office, and going to the hospital and doing anesthesia for this is preferable. Some people say, well, I don't like anesthesia. Well, the kind of anesthesia we run is called TIVA, or total intravenous anesthesia. It's not gas. They give you some pain medicine. It's like a long, long colonoscopy. Right? So you won't awaken during the procedure or anything like that, but it keeps everything sort of mellow. The incisions are placed here. Now there's wide variations, and I may change these depending on what I see. Right? So some people who have already had facelifts and they have a high temporal tuft already, you don't want to be cutting into that and raising the sideburn up and up and up. Sometimes it will come up in here. Okay? There's a wide variety of what they call short scar or mini facelifts. Younger patients tend to be a little bit better for that. If you have a lot of redundancy in your neck, which is skin and muscle, then we need to really continue the incision back into the posterior hairline. because there's excess skin and we need to do an excisional type of technique. Now there are neck lifts that are non-excisional, where we don't cut skin out, we just tighten muscles and try and tighten the skin. But if the skin is lax, it's not really the best option for you. And that's why a consultation is important, because we're able to discuss your options and I can put my hands on your skin and your muscle and really examine it and say, oh, well, these are your options and this will do this will do that, and this will do this. So there's lots of different types of facelifts. There's plicating, resected, and sort of this. This is sort of the way everybody's going these days, is an extended deep plane facelift. What does that mean? That means we are not just trimming skin. That was the first facelifts, where they would cut skin and sew it back together, but you have tension on the skin, and then you get widened scars. Right? Then there's resecting, which we would do for the layer underneath the skin, which is called the SMAS. It's like an amplifier of facial muscles. It looks like a lattice, all right? You can grab it, and you'll see it if you don't want to watch. Just close your eyes. And that's what we can pull, okay? And when you pull into your face, it helps your neck too. So people say, oh, I just want my neck done, but it doesn't really work that way. When you lift this, all this is connected. So you lift the skin up, you have a layer of tissue there, which is attached to this muscle down here called the platysma, which is these bands, okay, the shaving muscle from it. And as you lift this gets lifted as well. And then it becomes just pure geometry of where the skin gets cut out. It's tailoring. So, can you have an isolated neck lift? Yes, but you have to be the right candidate. We'll go over those patients. All right, so graphic, all right, if you don't want to watch. All right, this is me doing one. This patient's wide awake in the office. Okay. All right, this is a view of what it looks like inside. Okay, just lifting skin. All right, and that's the SMAS underneath. That's the layer of what we operate on. Okay. The skin is just sort of lifted. And that's what it looks like. All right, this is a deep plane facelift, different. What I can do in the office is more of a sort of a tuck up, all right? This is a deep plane facelift, and you'll see that this is the SMAS. It almost looks like chicken fat a little bit, all right? And that's me grabbing it. You can see this move as I grab it, okay? And so this is me getting down deep, so all the facial muscles and the facial nerves all lie there, and I'm all the way out here, okay? And this is the only facelift that can help those folds. Every single one of them doesn't go out deep enough. So I'm released all the ligaments of the face, and then I can put it where I want it. And that's her before, that's her right after. Now she's all red, she had a little brow lift too, and did lasering, that's why she looks like that. So these are the top questions I get. Is the facelift the same as a neck lift? Yes and no. The facelift does take care of the neck to a degree, but sometimes you have problems deep in the neck that need addressing. What are those problems? Laxity of the muscle here, called the platysma, hypertrophic digastric muscles, or these muscles that look like a bowstring right here. Some mandibular glands or spit glands that have become too big and cause a visible bulge in the neck. What are the risks? Bleeding. The number one risk from a facelift is something called a hematoma, or a blood collection under the skin. It's like a little blood blister here. If that happens, is it horrible? No, but that's why I see you about 6 times within 2 weeks, making sure you don't develop one. I use drains to evacuate blood, all right? I used to use tissue glue, and I may go back, I don't know. It's just trying to figure out how to keep problems at a minimum and maximize your results. The drain usually lasts 3 to 5 days, depending. The anesthesia, well, you can have an awake facelift where you're completely awake, but not everybody's a candidate for that. Or you can go to sleep, so you can have general anesthesia. How long do these procedures take? Well, it depends. Yesterday it took me about 8 hours to do everything on this patient, okay? But it wasn't just a facelift, it was a lot of different stuff. Also, if you've had a previous facelift, it takes me more time. I can't just snip, snip, snip. There's scar tissue that I have to make sure that I'm aware of. being safe. Does it hurt? Hurt is an interesting question. I've had patients come in post-op hour 12 and say, I've been fine. Then I've had patients say it's hurt for 3 months. What does it feel like? It feels tight, most definitely. Some people can't even chew solid food for 5 days. Sometimes it can feel, depending on if I'm doing a lot of extensive neck work, it can feel like somebody's hands are around your neck, all right? And some people with anxiety have a big problem with that. How long will I be bruised and swollen? Depends on how aggressive I am. It depends on what needs to be done, and we talk about that. But in general, if you're doing a huge, big, deep plane facelift, you're gonna be hiding out for 2 weeks. At the end of the second week, you'll feel, wear your hair down, okay to go out and go to the grocery store, right? And do life things. But going out to an event, you really don't look your best, right, until the 3-month mark. At 6 weeks, you look good, but the 3-month mark is really the sweet one. Do I use drains? Yes. I'm scared. I don't want to look like her. All right, everybody knows who that is, Jocelyn Wildenstein. She's, shame on the people who did this to her because she just, she's body dysmorphia. But this is, filler and silicone and looking like a cat or a lion. It's like, I don't prescribe to any of that. And you won't look like that. He's had a couple.
Huh? Racers?
Oh yeah.
Facelifts?
His ear is attached here, and it's not there.
Yeah.
That's right. All right.
That's right.
And he's obviously had his eyes done, right? And he's had a couple of hair transplants. All right, so 3 months test post faceless, people are like, oh, what are my incisions look like? Most look like this, all right? Where you can't really tell.
There's a scar, no scar.
Oh, there's a scar. If you look close, there'll be one, but it comes like this.
Oh.
You see here, it goes like that.
Oh.
All right. So at the end of it, I want you to be able to put your hair back, obviously. Right? Do some need a little extra work? For sure. Who are those patients? They tend to be darker skinned patients. Incisions on darker skinned patients tend to get darker first, and then they get lighter. And sometimes people have thickness of the scars, but that tends to be patients who are what we call Fitzpatrick 4s and 5s, people who are Latina or some Middle Eastern patients who are darker. All right, what do you look like at one week? Basically like this, okay? You can see it because I haven't even taken that staple out yet. All right, so the stitches go like this in the hair, all the way in the back. 1 week you look like this. This is blood breakdown, that's why you look yellow, okay? At the end of the second week, that's all gone, and you tend to look just swollen, right? Swelling occurs in a few places. Up in the mid-face, right? So I tell people, you're gonna look wide, right? You're gonna look real wide right here for a good 3 weeks, and then it dies down. All right? If it's too aggressive and too wide, I tend to give you some steroids to bring it down faster. I don't like using a lot of steroids. They have a lot of side effects. And also I'm doing a lot of resurfacing it sometimes, and that tends to blunt your response to the laser, which gives you the result. It's your body knowing and inflaming against the laser that gives you the result. So here's are some isolated non-excisional neck lifts. These are for younger patients who just have some thickness in the underneath the neck. So I didn't cut any skin out here. All I did was remove fat and tighten muscles, and then put a chin implant, right? This is one of those patients where, right, she was young here. She was in her late 20s. But this looks a certain way because this is retruded. Same thing here. Chin implant, non-excisional neck lift, and tightening this, right? Trying to reduce this bow streak effect. Same thing for this guy. Same thing for her. This involved liposuction as well. All right, so how do we tighten the skin without surgery? We have that here as well, but not everybody's a candidate for it. But some people want to do as much as you can. But in reality, if you're not operating, all these things, and this is well known, will give you 33% result of a facelift. All right. So if that's okay for you, you know, but you come in and say, I want to look like this, but I don't want surgery. I'm sorry. The only way to give you that result is surgery. Radio frequency, which we have, some people have ultrasound and laser, can tighten the skin and tighten the tissue underneath, but to only a degree. I've used, that my lightning lift is me combining surgery and some of these radio frequency devices to allow me not to cut as much on the face and get additional tightening. All right? So that's done in the office. And the theory behind it is that we're using this energy. This is a lattice of fat in the neck. If you were to take a huge microscope and look, if I lift your skin up the neck, it looks like this. It looks like, you know, webs. What the energy devices do is it contracts those webs. It brings them down. Okay? So this is me doing that in the office. All right. And you can see it here. This is called Renuvion. And you know, this is tailored to the individual. Some people are good candidates and some people aren't. We're just wide awake. That's the incision. That looks like that. Okay. We use what's called tumescent anesthesia. Now this is a lady who was sort of perfect for my lightning lift because it was really only some skin laxity down here and a little bit of jowling. So I made a small incision from here to here and then stopped. That allowed me to pull this up, and then I used my wand to take up to go after the neck. All right, so tighten that skin up. Okay. So that's her 10 days on. Here's one. I did the same thing. The only incision I did on this lady is through here and 2 little nicks behind here. Okay. This is a bigger sort of tailoring, sort of what it looks like. I'm doing it somebody who's a little bit older. This patient was in their 70s. Okay. It tends to coagulate the tissues a little bit more, right? But I'm not making big incisions down here, and I'm not dissecting into the neck. Okay. Some people need that, some people don't. All right. So I was able to pull everything here from here, and then allow the skin to be tightened with this Renuvion. Right? Obviously, you didn't take care of those because it won't, right? It's not going to take care of this underneath here, but it will smooth out the neck. All right, here's the big guys. These are the ones that I mostly perform. Who's a candidate? Everybody's a candidate for this. It is the most aggressive. It takes me the longest. It has the most downtime, but it also works. So this is called an extended deep plane facelift, neck lift, liposuction, platysmoplasty, autologous bachelors. Okay, what does that mean? It means that I'm lifting this muscle here up, I'm lifting this up, I'm going through the ligaments of the face, and then everything is loose. And I sort of pull it where I want it. Okay. Who needs liposuction, who doesn't? It depends. I basically will touch your neck and maybe smile. If I can feel fat underneath it, that means you have fat above the muscle, all right? To tell you the truth, I don't suction a lot of fat above the muscle. That's usually rarely the only cause. Now in young patients, maybe yes, but patients in their 40s on, really, unless you have a super heavy face, don't have a lot of fat to suck out. So some people will say, oh, I just need liposuction, where it's actually a bigger problem than that. This patient lost like 70 to 90 pounds, okay? So she had a lot of excess skin, all right? And she became gaunt in the face, so we had to do a little fat transfer. But to get from there to there, I mean, you can never even see where her flaring started, so we're accentuating that. And she had this big midline, loose skin, loose muscle thing. All right. I think she's about 6 months. Another extended deep plane facelift. Now, this patient, I also did ancillary procedures, brow lift, and upper and lower blepharoplasty, so an eyelid lift. All right. So this one is an eyelid lift above with a brow lift. Then we come through the lid here to take the fat away. All right. And then lift the face. Extend and decline face of neck lift with tendinoplasty liposuction again. Ear post-op. Incisions are good. Same thing. Now, what's a lip lift? The people are like, oh, some people don't even know what that is. What a lip lift is as we get older, we definitely lose fat in and around the mouth. That's why your lip involutes doesn't stick out, it becomes very thin. You start to the red starts to disappear. You can't put makeup on anything really. The lipstick doesn't go anywhere. And so what the lip lift does is it allows us to evert a little bit of the lip, right? So it gives you a little bit more volume, a little bit more tooth show, okay? And it also decreases the height, right? So as you lose sort of volume and everything involutes, everything looks really long. All right, so that's there, okay? So you can see this involuting, and now we see the cant of the lip being back up. And then smoothing out the neck and the jawline. All right, so she's at a year post-op, and you know, redheads heal real good. Who heals really good? Fair people heal really good. Right? People who get skin cancers, they heal the best. All right. Your redhead, your blonde, you feel good. Another one. So we did some laser resurfacing on her. Okay. No, she looks really good. Why? Because she's got a strong chin. Right? When I saw her in consult, I was like, you're gonna look great. How you like, oh, your chin's strong. I can pull against that chin. And it creates this lever effect. All right, extended deep plane face of neck lift, platysma plant, platysma this muscle here. Upper and lower eyelid lift. Ptosis repair. What's ptosis? People come in, you know, my eyes are droopy. You know, one eye that's hanging down. They'll say, I need a blepharoplasty. I'll say, no, you need a ptosis repair. Lip lift, and then afterwards she had a full face halo. So we shortened her upper lip, we took care of her droopy eye, we removed the fat underneath there, and then did a face. All right, same thing, lip lift. I actually saw her today, she was a year out, and it's still a little red right there.
Where are the incisions for the lip lift?
So that's a big thing to consider with the lip lift is like it looks funky for a little bit. And 50% of the time, I got to laser it, all right? Blend it in, all right? And so there's a lot of patient, if you're young and you just want a little bit of lip, I'm gonna say, no, you don't need a lip lift, all right? You need to have an excessive length and you don't really want to be dark. I can do it on dark skin, but like it is almost 90% that I'm gonna laser you if you have dark skin. Reason being is you're always eating, you're always smelling, you're always moving, and you're constantly putting tension on the incision. Right? And tension on the incision is what creates bad scars. I mean, when people come for their post-ops and wear their hair back, that's a good sign. All right, this is a secondary facelift. All right, so some people come in and like, I'm ready for my next. Usually that occurs 15 years down the line. So we did all these things, and then we did some resurfacing. So 10 days post-op, so we did laser here, and we did facelift. Okay. It's a little blurry, I'm sorry for that, but you can see what it does to the lip. You can see a little bit of redness there. She was out with her girlfriends 10 days eating. We went out to lunch. Is that the norm? No, but it's possible. All right, so long upper lip, laxity of the muscles, fine lines in around the mouth. So lip lift, really sharp angle. You can see the hyoid bone. So lax skin, your real deep folds. You'll see that's good. So she got a real crisp jawline. And then at 10 days, this is what it sort of looks like. It's sort of scabby. These are dissolvable sutures. There's a combination of staples, dissolvable sutures, and regular sutures. We see you a lot, all right? So you have a facelift, I see you the next day. I make sure you don't have this blood collection underneath your skin. If you do, no big deal. I put a needle in and I suck the blood out. It sounds weird, but it's pretty common. And then I see you 3 or 4 days later, and if you have a drain, I'll take your drain out at that point. And then I see you 2 days later, I start taking stitches out. I see you 2 days later, I continue taking stitches and staples out. And then I see you 3 days later, making sure everything's healing. So it's a commitment coming in. So it's a lot. It's a lot. All right. So that's facelifting, neck lifting, questions in a nutshell. I'm here to answer any questions you have.
How can other surgeons get away with not using drains?
Well, a lot of, I know probably who you're talking about.
What was the question?
How do some surgeons get along with not using drains? And I never did for a while. And then I switched because I saw my hematoma rate increasing. Which, if you have a hematoma or a seroma or a fluid collection underneath the skin, it can lead to poor healing. Now, I'm pretty aggressive in these, and everything is open, all right? So if I'm what's called delaminating your skin, all right? So it's open from here all the way to the other side. There's a potential space in there for fluid to accumulate. I used to use tissue glue, something called Artis, which takes care of it, seals it back up. But even with that, I found that my hematoma rate was at around what the national average was, and that wasn't acceptable. So national average is about 10%. So people freak out about drains. Do drains cause problems? No. Can they hide a problem? Potentially. But it doesn't hurt to take out. I mean, I've got a couple of Instagram things to pull it out. It's not big, but my dissection's pretty big all the way down here. Right? Mark Jacobs had 2. They look like little grenades. I use usually 1.
Where are the drains at?
They come in through here, and it comes all the way down into your neck and all the way over here. So if you go on our Instagram, I got one knee, you can see it going, comes right out. So, yes, people who aren't using drains now, these surgeons did use drains in the past. A lot of this is sort of like, how far can we push it without inconveniencing the patient so much? But I have less problems personally by using drains. Other question.
Now, how different is, my friends are talking, what is the vertical lift?
Yeah, so that's a surgeon out in,
Yeah.
we're all facial plastic surgeons, and these are things that are marketing related. So
But I mean,
vertical is a direction, right? Am I pulling purely vertical here? No, I'm pulling along the course of this smiling muscle, all right? So everything's coming up this way. If you pull too vertical, that's the wrong thing. It's just sort of a marketing term. So it's, vertical restore, vertical prevent is sort of just his way of saying, this is the way I'm doing a facelift. Without sometimes entering the neck, sometimes not, all right? But it's not a technique at all. I mean, he might do something a little bit different, but in essence, it's releasing the facial ligaments and repositioning the mass. It's not a completely different operation.
I have a question.
Yeah.
So, it's up to the surgeon or up to me if I should do facelift? The reason I'm asking is because I went to 2 different surgeons asking to do consulting or something. They all tell me, you're not ready, go home. Yeah. So, but I said, I'm ready, I want to do it. No,
Well,
you go home.
we're here to educate you and tell you whether it's going to be worth it for you in the long run, right?
Yeah.
So I had a patient come in who had the nicest jawline in the world come in for a facelift consult. I'm like, if I touch you and do all this, all you're going to have is scars and you're not going to look any better, right? You have to be ready for it, meaning I have to be able to pull things.
That's what I mean.
And I have to be able to give you a result, right? You'd be very unimpressed and unhappy if I put incisions on you and you look the same. So if we feel that, I mean, anybody who has a conscience will tell you, wait, right? It eventually will happen, maybe not, and if it doesn't, good for you, but it eventually will. And when that time comes, that's when you're the right candidate. I will see
Yeah,
people
don't be
who are
in a
candidates
hurry.
at 33 and others who are 62 and still don't really wouldn't benefit
Well,
from
the
it.
reason is in China, it's like a 42 years old start doing facelift. You know,
Well,
they're
they're
very
doing it,
popular.
they're doing it
in
here
Asia.
too, but it's just if you're gonna
But
notice a
if you
benefit.
need it, some 42-year-olds need it. They're telling you, just,
What about the lip lift? Does that get rid of the lines?
No.
No.
It effaces them to a degree, but it doesn't get rid of the lines. Those are inherent in the skin itself, and I'm really not, I'm cutting skin out, but I'm not trying to efface those lines. They're vertical lines that are always there from that. They're best used with what's a combination of what I did yesterday. It's a combination of laser and what's called nanofat. Nanofat is fat that you parcel down, so there's no fat cells, it just has the regenerative qualities, and it can make your skin look better, and it helps with wrinkles and stuff like that. We use a needle. I can do that even in the office.
How long does that last?
A lip lift or the
No,
nanofat?
the fat.
Well, the catchphrase is fat is predictably unpredictable, all right? So when we put fat in, I'm putting a ton in, all right? And it might scare people how much fat I'm putting, because we know only 50 and at best 60% of it lives, okay? At first, it's a volume effect, right? It's all puffy and big, and you're like, ooh, this is good, and then I'm gonna tell you, ooh, I really like this, and then it goes down, 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 down. The reason being, to survive, it needs a blood supply. Your body doesn't automatically send a vessel there to cause the blood or the fat to live. That takes a period of months, right? It's called neovascularization. So what happens is that you see a dip, but at around the 6 to 9 month mark, it starts to come back again, all right? And that's because that fat that's been put there has certain stem cells, and then grow a little bit more fat. Skin tends to look way better with fat too. And fat for volume is without the problems of filler, right? Doesn't really migrate, it's part of you, your body doesn't attack it, doesn't encapsulate it, you don't get inflammatory granules. You can get a little bit of what's called fat necrosis, which means if a glob was stuck in a little bit too much, that it turns into a little bit of scar, but that can be modulated in the office. So you don't get these Tyndall effects, you don't get blue shadows underneath the eyes, you don't get any of that. So fat is great, but there is a touch-up rate, right? So it isn't always going to stay there. Sometimes people need a little bit more. If they need a touch-up, if it's just fat, we can do that in the office. We numb you up.
And where do you get the fat?
Belly or thigh. Some people don't have any fat. I ran into that a couple of times. To use like tricep, or you have to go knee. But it's tough. If they're really, really devoid of fat, then it's sort of like, oh, I don't have anything. I can't do that for you. And then we're sort of stuck.
You can't use cadaver fat or.
No, there's purified fat stem cells and mesenchymal stem cells, a product called Renuva, which is exceptionally expensive, but there's really not great studies that show that it causes a lot of volume. It does well. People will use biostimulatory things like hyperdilated radius or Sculptra to try and get in those areas up, but it's not soft like fat. Fat's really soft. It doesn't have a lot of lifting capability, meaning filler can lift, right? It has inherent strength in it. So if you were to glob filler here and put a little Post-it pad on it, the filler would hold it up. If I did that with fat, it just would go flush out. So it's soft, and they're used for different reasons.
Now, I also heard that using sculpture or threads, that you should avoid that if you're going to do a facelift.
It's interesting. Have I run into that in my own patients? Yes. Threads aren't a problem for me. Okay. The biggest problem is using big-time energy devices and then having a facelift within 3 to 5 years. Okay. Sculptra, yeah, it creates a scar tissue band, but when you're doing a deep plane facelift, you're going underneath all that skin stuff anyway. But yeah, the term is scorched. You want to stay away from these types of things. But however, if you're thinking about doing a facelift within 5 years, you're correct. You probably want to have a frank discussion and plan for that. Threads aren't a big deal. Sculptra, somewhat, but big-time energy devices, you may run into, may make it more difficult for the
Is that like
surgeon.
Morpheus?
No, not even Morpheus, but like my Renuvion, like that I use. Like I wouldn't just do an isolated Renuvion and say I want to do a facelift in 2 years. No way.
You
I've
do-
done it.
you do-
It takes me a lot longer.
You do the thread lifting here?
I don't.
Oh, yeah.
Nicole does.
Oh, okay.
And so, you know, threads are fine. You just have to understand what they do and what they don't do, right? Does it give you a facelift? No. Is it permanent? Heck no. Will you look pretty good for 6 weeks to 2 months? Yeah, you will.
But that's mostly on younger people.
What's that?
The threads look better when you're younger and you have the skin pulled up.
Correct, and the downtime. You know, everybody's at a different point in their life and a different amount of change in their pocket. So it's the truth. You know, I don't want to spend this much and I don't want to have downtime. What can I do? Well, this is an option. But you're not having a facelift, right? And so a lot of social media is very misleading in that way, right? A lot of the befores and afters that they're showing is immediately right after. Everybody's swollen.
Dr. Zulian, can you clarify something? You said that the facelifts don't remove fine lines, but are you talking about like marionette lines?
No,
or
those aren't
like-
fine, those are
That's a-
folds.
That's a
folds,
fold,
yeah.
okay, that's just.
So, and they never will remove those completely either.
Yeah.
But they efface them, right? So you'll still have folds here. Babies have these folds. You're born with them. I mean, you don't even, if you were
They look cute on them.
yeah. If you had no folds or anything, you'd look very alien-esque, right? It's whether the depressions extend down in here and extend down into the jowl. Right? That's what gets effaced.
Is there a risk of nerve damage?
Yes.
when you do all this?
Oh.
Yeah, of course.
Risk of what?
Nerve damage. What is nerve damage? Will you feel numb? 100% you'll feel numb. Up to anywhere I lift the skin up, it's almost like tearing sod off the grass. You have lawn, right? That seed isn't. If I lay that sod back down, it's not growing for a while. That's how nerves work. It's roots growing up from that. So sensory disturbances are very common, right? That's a specific nerve. Sometimes people get a little numb in their ear. Sometimes they feel it up here. I had a guy who I saw today. He's how far is it? 3 months now, I think, 3 or 4. He's now just getting sensation back down here.
Come back.
But it comes back.
Oh.
All right.
Not always.
Not always.
Yeah. So it depends if not always. Sometimes there's a nerve that travels up here that if you nick it, your ear will be completely numb always. That's the most common injury. Facial nerve problems exist, but my permanent rate of facial nerve issues is 0, okay? But 3 to 5% of the time, because we have to stretch this tissue and the nerve is like a thin little piece of linguine in there, or angel hair, you can't even really see it. You have to stop bleeding sometimes, and so the electricity from what's called the bipolar can travel to the nerve and stunt it, or it swells around the nerve because of swelling, or you're pulling it. You get what's called a paresis, or the nerve isn't firing right away. And 3 to 5% of the time that happens, and your smile's a little funky. You smile and one side's up. Okay? But it lasts about 6 to 8 weeks. I used to freak out about it when I didn't have gray hair. Gray hair, I don't freak out. I said, you'll be fine. And every one of them's been fine.
What treatments do you like before a facelift? Like, if you're gonna do a facelift in a year?
Okay, so things that definitely work, Botox.
Yeah.
All right? 100%. Getting
Before
your...
the facelift?
Yeah, why not? Getting your skin ready to look nice, all
Yes.
right? So you can start doing light lasers and things like that, and peels, getting the skin as tight as it can be. I try to avoid filler in the regions that I'm going to be operating on, okay? So that means not here, but lips is fine, the chin's actually fine.
How long do you want somebody to stop before they're putting filler?
So, I mean, I've dissolved people who've had, loads of filler over many, many years. Does it ever really go away? We know now it doesn't. It's in you for a long, long time. So, in certain areas it's fine, in certain areas it's not. If you're doing your cheeks, I don't want you doing your cheeks, really. It's sort of like, give it a year. And if I see some and I think that it's still there, I'll dissolve it.
What about the lip lift and filling on lip?
That I like to dissolve before I can even tell you, because I need to measure how much I'm taking out. So that can obscure that. Right? again, for the lip lifts, it's not how much you take, it's how much you leave behind, which is really the important thing. So the young girls in Vogue and stuff like that, their upper lip distance is about 12 millimeters. I would never do that to a 50-year-old woman, it would look ridiculous. You have to have it age appropriate.
What kind of diet do you prescribe before?
Well, every clean stuff. So I try to tell people about a month before, you want to avoid things that are inflammatory. Okay, what do I think is inflammatory? Milk and dairy products and gluten. All right. More so for rhinoplasties than for facelifts. But the cleaner you can be, the higher protein that you get your body in, what's called a positive nitrogen balance, because it takes a lot to heal from this. Right? It's not, you don't wake up the next day and you're like, oh, I'm good. That's not it at all. You have to be in the right spot in your life where you can take 2 weeks off for yourself and not worry about much. Right? 'Cause you don't want your cortisol levels going crazy. You won't heal good. And take care of yourself, or have somebody there who can take care of you as well, right? So a lot of people hire nurses, some people have spouses that are, you know, into it and things like that, but you need support during this. You know, don't do it alone, and go sit in your bedroom.
Along the lines of the food you eat, how about like collagen supplements
I
and
don't
stuff?
believe
Is
in
that, okay, so it doesn't, nothing that'll help collagen
I mean,
and.
collagen's great. I mean, you can convince yourself it's working, but the problem is you're ingesting it and your stomach acids are breaking it down.
So how about other things that, to plump, does that make
So
your skin better if you use stuff that'll,
vitamins are great, all right?
that help you
I
make
know-
your skin in better condition to go for
Well,
this?
yes and no. Okay, so it's more about drinking enough water and staying away from sun. That's the most important. Okay, you're not going to reverse any signs of aging by taking vitamins or collagen powder. It's not.
No, but I was more in terms of, is it making your skin in a better place, preparation for?
Usually, getting your skin turnover, a higher skin turnover where it's healing faster is a retinol. Okay, so topical retinols cause your skin to speed up healing. All right, so even before lasers, we'll say you should start a retinol, get your skin ready to heal. And retinols are great for fine lines around the eyes. That's where they work with us.
Pills all the time.
Yeah,
Yeah.
that's the side effect of them.
Yeah.
There's nothing I do that doesn't have a consequence. No, I'm serious.
You go to work every day,
Yeah.
your skin.
Yeah, you have to be ready for the there is no magic bullet, all right? Everything has a specific consequence, and we'll teach you what those consequences are. And then the patient and you have to decide whether I'm okay with those consequences that are going to happen. Right? The numbness, the things like that. If you're not, then don't have surgery. You drive something else.
Do you recommend doing lasers with every facelift?
Depends. Sometimes I'll say you start before, because it's not that bad. You don't need a big old CO2 guy. You can do little teeny peels, which 3-5 day downtime without 2 week downtime.
Before the
Yeah,
facelift?
it doesn't hurt. The patient I did yesterday, she had a laser like a month ago, big time. She's still red.
How long are you in the hospital?
The
You
day
leave
of
the same
surgery.
day.
You do?
Yeah. I had one patient stay the night because she had a bleeding disorder. That's it, ever.
Yeah.
You're much better at home. Why? Because you don't have bells and whistles going off, and people aren't waking you up and shoving Jello in front of you. You'll sleep much better in your own house, for sure.
How long before you can color your hair?
6 weeks.
6 weeks.
So most
Get
people do it
that
the
spray
day
out.
before surgery. And then we have surgery, and then 6 weeks. I don't want staining in the incisions, right? So
Right.
there's micro openings. I don't want that getting in.
Is your incision placement the same for everyone?
No. Depends on your hairline, depends on lots of stuff.
Depends on your face, because I have a friend that had facelift, and it changed the whole shape of the face. So is that because the fillers they put in, or how they pulled it, or?
I can't speak of that, so I don't know without seeing it. But it usually comes down to the vector of pull and the tailoring of the skin.
Do you have to wear a band for
But
it?
yeah, you look like you see like Marc Jacobs, that's what you look like.
Yeah.
Like a Q-tip for a day,
Yeah,
and cut it off the next day,
yeah.
and then I give you a jaw bra.
Yeah.
You wear it. Now, there's some surgeons say, you don't need it. Yeah, I think it makes you feel better because it's tight.
Yeah.
And it puts pressure on it, right? So if you twist your knee, what do? They wrap it. It's the same sort of thing. You're putting pressure on it to alleviate the swelling.
You said you do some in the office.
Uh-huh.
Do you ever do a deep plane? I'm not for me, but my mom was thinking about doing a deep plane, but she doesn't want to be put
Yeah,
under.
it's sort of hard to do.
Okay.
It's sort of hard to do in the office. Not a lot of people can.
But you do like little neck.
Yeah, little tucks here and there, like those people like to go do, but they don't have a lot of issues going on. But enough to where I feel like, if I feel like I can't do a good job in the office, I'm gonna tell you. And you'll say, I want to do it in the office. I'll say, okay, well, it's maybe 70% of what I can do in the operating room. Yes.
So average is like 3 weeks before you can go back to work, probably?
2.
Yeah.
2. You feel okay at 2. I don't want you out in the sun for 6 weeks. I don't want you working out for 4. Now, does that mean sit in the house in the dark? No. I want you outside, walk, move. You're not an invalid from this. Right? It's not like a major abdominal surgery where you can't move your core or anything.
But I'm saying like the bruising, is the bruising?
Yeah, I mean, like that girl at a week, it's fine. At 2 weeks, the bruising's pretty much gone. I saw a few people today were 8 days out, still a little yellow. But more, I'm not worried about that. It's the puffiness where people notice. A little cheap. But that dies down. It's also.
Are retinols and retin A 2 different things?
No.
Same?
Yeah, same family. Vitamin A derivatives. Some are oral, like Accutane. But retin A is a topical retinoid.
Thank you.
No problem. Other questions?
I have one other
Yeah,
question.
sure.
Can you do a rhinoplasty and the facelift at the same time?
I can, and I've done it before, but it's brutal for both of us. Because
It's like 9 hours.
It is, you feel super, super tight, and then your nose is swollen, you can't breathe out of it, and you're asking for misery. I've done it before. I've done it before, but it's a long, that's a long day for both of us.
What about the LED lights? Been
Yeah,
hearing a lot about-
yeah, so red light's good for healing and things like that, but it's not gonna do anything to make you younger, but you know, red light therapy is good. We have some of that with our lymphatic drainage that we give you, and you know, next stop for me is trying to get a hyperbaric chamber.
Oh, yeah. Those are great.
Yeah.
But they're exceptionally expensive. And the ones that aren't up to 3 atmospheres don't really do anything. So like a lot of people will have them, but if it's not at over 2 atmospheres, meaning the pressure, it does not work. It doesn't really push oxygen into your tissues.
Doctor, I think you said it earlier, but what do you use for anesthetic then for the surgery?
Called propofol.
Propofol,
Yeah,
okay.
Diprovan, Tiva it's called. But they modulate, they give you pain medicine during it. I want your certain parameters met so they can titrate it. I want your mean arterial pressure at 60 to 65 so I don't encounter clots of blood and things like that. I can move quicker. So that's why anesthesia is important. So people with high blood pressure or anxious, I'm going to look at that in medical history and be like, you can't do this back here. Ain't no way.
So when you do consults in this office, like you come in, do you at the same time talk about potential surgery versus other
Yeah,
options?
I give you all the options.
In some places, I think you can go to people that do, there's 2 separate
I might
consultations.
not do the ancillary stuff
No,
itself,
but you would-
I'm
but you-
versed in talking about it.
Okay, yeah, because other places I've talked to, you have to talk to one person if you want
No, no,
this.
you can talk to me about anything, it's just whether, you have to understand the ins and outs of all of them, right?
Right.
And what your expectations are, right? A lot of times, your expectations are here, but reality's here. It's my job to do this.
I did want to mention too, you have some questions coming through in the live feed, but for everyone listening, we'll just answer them in the comments later. So your questions will be answered if you're commenting online.
You can answer that one. You can answer-
It's kind of hard to see because they're like
Was there
up
only
and
2?
down.
Oh, she's scrolling back right now. Okay, first one, do you perform earlobe reduction with a facelift?
If you need it, I can do that.
And second one, do you shave the glands if necessary?
Yes, so shaved a little bit of one yesterday. Not everybody needs it. I'm able to push them back. But some people, when I feel your neck, I'm going to feel to see if the glands are big or not. But with the gland shaving is a little bit of increased risk of nerve injury and bleeding. So it takes me longer in the surgery to do that, because I have to be very, very careful.
Is a short scar facelift ever appropriate?
Yes.
Those are more like the in-office ones that he's
it is.
able
It
to
depends
do.
on what, like everybody's different. Everybody presents me at different ages and different problems, but do I perform them? Yes.
Well, I never heard of that.
That's a short scar. It's a mini facelift. That's a short scar facelift.
That's basically what he's doing in the
So
office.
everybody, S-lift, a Manhattan lift, everybody's got a different name for everything. It's all hoopla. Right? Everybody's got their own name for everything.
So
right?
only for like this much?
That's a full. Yeah.
Oh, that's full.
Yeah. So, but those are the different things that can be done. So certain patients, I'll be like, yeah, you can have a mini facelift, but your neck ain't gonna get better. Well, I want my neck to get facelift.
No, but you said the brow lift, you have to do, how do you do
You
the
do it
brow
the
lift?
same sitting, like I do that a lot, but it does that. A brow lift is done a variety of ways, right? There's not just one brow lift. There's a lot of different types of brow lifts. The biggest thing to notice with the brow lift is how high the forehead is. Okay, so if you have a high forehead, or more than 6.5 centimeters from here to here, you do a brow lift, it's going to move your hairline back. All right. Now some people wear bangs, and they don't care about that, but you have to do a very specific type of brow lift in patients like that, which means a trichomonic one, which means incision along the hairline. All right. So you can bring the brow down and then do a forehead reduction at the same time, and cause this to come down, the brows to come up, and eliminate skin up there too. But that takes 2 hours. A normal endoscopic brow lift for me takes 45 minutes. Right? So it's not just all the same. And this past week somebody just needed a temporal brow lift, where you just set the temple here, not a full brow lift. So that's what the consultation does. It's like, I'll go into each one of them, like, this is the pluses and minuses, this is what I think you should do. And that's up to you. I'm just here to educate.
But you can't get a brow lift with a facelift.
Oh yeah, at the same time, for sure.
Are you doing in person?
Oh yeah. Yeah, it's been a year.
Yeah, because I paid for, did the Zoom, but haven't done the in person.
Yeah, that's fine. So we stopped about a year ago, or 9 months ago.
But the brow lift is separate from,
Separate incisions,
separate.
same time. Yeah, I would know, a lot of those are upper, lower brows and brow lifts, all done at the same time. But that's our whole day, me and
The neck bands, does that go away when you do a?
yeah, so there's a variety of ways in which to get rid of them. All right. Sometimes if I do this to you and your neck bands go away, I really don't think I have to tie the bands together. All right. However, at rest, if they're splayed and I can see them on you and still around there, then I'm going to do what's called a platysmoplasty. We're going to tie those bands together. Okay. That's the first thing to come back after all of these. Right? The reason being is you're constantly doing this and smiling, right? It's a depressor of your lower lip. You do this, you go, oh my God. You're putting pressure on my stitches, right? And I don't want you doing a whole lot of that until things sort of heal together. But even with time, that's why people need secondary facelift. It will continue to de-age. It's not a permanent fix. There's nothing about this that's going to last 50 years.
How much time in between usually the first? That's my problem. I have that really strong platysmal.
Yeah, so, somebody like you has got a good jawline, you can do a platysmoplasty in the office, right? Non-incisional, ties it together, and it'll be good, right? But 5, 8, 10 years, I don't know.
There.
It's just, I wish I could tell you exacts for all this, but because of the highly highly individualized problems that people have, it's not just a standard rote answer. Right? But that's one of the first things to come back is these guys.
There's no side effects to like tying them or.
No, you just you feel tight, and some people can't even swallow.
You did mine in the office.
Oh, yeah.
years ago.
It's all about like, for the rest of your life.
No.
No.
What do we
Well,
got?
five days.
Couple days.
5 days. But it's, you know, it's, of the things that's a rather simple thing to do, to tie those. It's, you're just wide awake. But I'm not cutting any skin out, I'm just tying the muscles together, and I'm relying on either one of my devices to tighten it, or just your skin, if you're young, to suck back up. Other question?
Once you loosen all that skin with doing that facelift, does it seem, because I've seen people that have had multiple facelifts, and
They're
it seems
shiny?
like once you get one, it seems like then you need one in about 10 years or 5 years.
I don't know.
I've been afraid to get one.
I don't know. I guess I don't understand the question.
We
Or
don't
the
find
comment.
When
Or
you're
the comment.
loosening all that skin and then you tighten it, does it grow back?
No.
Does that reattach?
No, but what you're noticing is that 5 years later, you're 5 years older.
Yeah.
And she was older, our friend was older, she was 70.
Yeah, so what happens is the skin elasticity just gets worse and worse and worse, all right? That's that escalator, all right? That's why between 48 and 55 is really good, because you get the most bang for your buck.
Yeah.
Do it later in
You
life.
look great at 48.
Well, but you can see how much skin I remove, right? See this
Yeah.
line? That's
Yeah.
there. See this line? That's almost gone.
Yeah.
Right, so it's
Yeah.
that much skin. I mean, when I'm done, when I'm doing it, I'm pulling the skin over your ear.
Okay.
How old was she?
She's 72.
I'm 76.
Yeah, I did yesterday was 72 or 4.
Would you still do it?
Yeah, if you're healthy.
Okay.
There's
Some-
no age limit. The eldest person I know is 81.
Really? Because the one surgeon, remember, he said nobody over 70, he won't do
Yeah, he
anybody
won't
over
do it.
70.
You have to understand that what I do isn't necessarily permanent also, because the skin just relaxes. Some people, you know, good cheekbones and good jawbone, it's gonna last a little longer. That's all, you know, flatter face. You're fair, you have skin cancers, and your skin just relaxes, it's raisin-esque and not tight, it's gonna relax. It's like, I can't stop that. All right. Thanks everybody for coming out.
Thank you.